Legionnaires' disease outbreak in NYC. What you need to know. A deadly outbreak of Legionnaires' disease has claimed 2 lives and sickened 58 others in New York City's Harlem neighborhood. The outbreak, which began on July 25th, has health officials on high alert as they work to contain the spread of the bacteria. But here's where it gets controversial. Despite the city's efforts to remediate cooling towers that tested positive for the bacteria, some argue that more needs to be done to prevent future outbreaks, and this is the part most people miss. Legionnaires' disease cannot be transmitted person to person, but rather through breathing in water vapor containing the bacteria. So what do you think? Are city officials doing enough to protect the public from this deadly disease? Let us know in the comments. Legionnaires' disease outbreak in Central Harlem. What you need to know. In a concerning development, a second life has been lost due to Legionnaires' disease in Central Harlem, bringing the total number of confirmed cases to 58 since July 25th. This outbreak, which spans several zip codes including 10027, 10030, 1035, 1037, 1039, and neighboring areas, highlights the urgent need for vigilance in our communities. Legionnaires' disease, a form of pneumonia, is caused by the bacterium Legionella, which flourishes in warm, stagnant water systems. It spreads when people breathe in tiny droplets of water that contain the bacteria. For example, this can happen when showering or using a cooling tower system that hasn't been properly maintained. If you live or work in the affected regions and notice flu-like symptoms such as coughing, fever, chills, muscle aches, or trouble breathing, it's crucial to seek medical attention right away. Early diagnosis and treatment are key to managing this illness effectively. But here's where it gets controversial. Despite the seriousness of the situation, some might question why it took so long to identify and address the source of the outbreak. The Department of Health and Mental Hygiene has taken steps to remediate the 11 cooling towers found to be contaminated with Legionella last week. However, this raises questions about whether more could have been done to prevent the spread of the disease earlier. According to Acting Health Commissioner Dr. Michelle Morse, anyone experiencing symptoms in the affected areas should contact a healthcare provider promptly. She emphasized that while Legionnaires' disease can be successfully treated with antibiotics, certain groups, such as adults over 50, smokers, and individuals with chronic lung conditions, are at higher risk and should remain particularly cautious. It's worth noting that Legionnaires' disease does not spread from person to person, which means proper water management and maintenance are essential to preventing future outbreaks. As we move forward, it will be interesting to see how the situation evolves and what measures are taken to ensure the safety of our communities. What do you think? Should there be stricter regulations on water management in buildings? Share your thoughts in the comments below.